Yeah, 6 feet.
Looks loaded,
So, it looks like it's loaded.
Good evening. We'll call the Corpus Christi City Council meeting to begin and commence at 6:31. Call to order and ask Ms. Huerta if she would please call the roll.
Mayor Joe McComb,
Here.
Council members Roland Barrera,
Here.
Rudy Garza,
Here.
Paulette Guajardo,
Present.
Dale Hernandez,
Here.
Michael Hunter,
Here.
Ben Molina,
Present.
Everett Roy,
Here.
Greg Smith,
Here.
City Manager Peter Zanoni,
Here.
City Attorney Miles Risley. Here. Mayor and Council, a quorum of the council and the required charter officers are present to conduct the meeting.
All right. Well, let me first thank the council members making themselves available for a meeting this afternoon. We weren't scheduled to have a meeting this week, but under normal circumstances, but with the holiday that we've had and the increase in activity that we've had throughout the community on our COVID-19, I thought it would probably be a good idea to get everybody brought up to date and at least be all focused on one, whether we're in one location or like we have some online, but get a chance to hear from Annette on the health district and where we are and what we're doing, and Peter to give us some updates on some information. But before we do that, I just want to say how much the pandemic is impacting not just the city itself, but the staff and the time that, and the consumption of time that the staff, the city staff, the county staff, the hospital district staff are spending on this. What you see at the 5 o'clock briefings and maybe at city council meetings comment, that's a nanosecond compared to the amount of time that they're actually spending on this. It's a 24/7 job, and while there may not be a lot of publicity of what they're doing, they're working tremendous, and that goes to first responders, nurses, and doctors. And so I just wanted to be able to have an opportunity to provide the information to you about what all is going on. This is that we have no action item on the agenda. This is basically for information, but I mean, the way that's written, it says there's possible action, but I'm not aware of any action that we're expected to take. It's simply for information, to ask questions that we might have. It's not a meeting to cast aspersions or be negative. It's really for information, to update where we are, what's happening, and for clarifications. If anyone has any questions they'd like to ask, we'll have the experts here, either directly or online. And so at that, I'd like to again say thank you to all of the people that are doing this on a daily basis, particularly the staff members, which you see here and which you don't see here, and the time that it's eating up on them. But I think, Mr. Zanoni, if you would make some introductory remarks on what you're wanting, and Hillary is it, and Hillary is here. She's the lady that really is behind the radar screen. Not many people. I think this is the first time I've actually seen her in person when we first started meeting, or maybe I don't recognize you with your mask on. But when we first started these meetings, it was teleconference. It was just all on the telephone, and then we got a little smarter and got to Zoom and some of the others, so we've been able to pick up a few faces here and there. But in a meeting like this, we're glad you're here. She's the lady that crunches the numbers on a daily basis, keeps the hospital district, the hospitals, and everybody informed as to how many beds we have, how many in, how many out, and that sort of thing. So she probably doesn't need to be rocked to sleep at night when she goes home and puts her head on her pillow, I would think. But anyway, we're glad you're here. But to Mr. Zanoni, if you would make your opening comments, and then we'll hear from Annette and from Hillary, and then the council is certainly welcome to ask some questions. We want to try to be out here. We recognize they're tired. They've been at it way before 8 o'clock this morning. They're tired. They need to get home, get some rest tonight. And so we'll try to get out of here. Well, let's just say I'm going to adjourn at 7:15 if we're not finished. I can adjourn earlier if we're finished. But we ought to be able to get a lot of information in the next 30 to 40 minutes. So, Mr. Zanoni.
Okay, good. Thank you, Mayor. I don't have too much to say. You've introduced Annette Rodriguez, our Public Health Director, and she'll be giving us a thorough recap. It's been, like you said, it would have been 3 weeks before the council has met. And then Hillary Watt, her title is Executive Director for the Coastal Bend Regional Advisory Council. And for viewers and us that may not be familiar with it, the Regional Council is one of many in the state of Texas that help in times like this. They coordinate trauma systems and hospital capacity so that we're serving as many people as we can, helping with resources and that type of thing. So that's Hillary's job. She'll give us an update on hospitals and the system. Just let me tell you the numbers real quick. So today at our press briefing, we announced an all-time high of number of new cases for one day, 445. We thought yesterday was going to be a high. It was 388 yesterday, but today is a 15% increase. The total number of active cases is close to over 4,400, 4,400, but Texas A&M Professor Dr. Bird, who's been presenting for many months now, informed me today that the Center for Disease Control says that you can take whatever your active cases are and do a 10-time multiplier on that. And that would account for people that haven't been tested or don't know the test results or don't even know they have the virus. So if we did that, we could estimate that about 12% of our population has the virus, right? So this is serious stuff. We're at a serious point, I think, in the tracking and the managing of this. We have 302 persons in the hospital, 103 in ICU, and 35 deaths to date, with the last 2 days, 8 deaths in each of the last 2 days, so 16 total just in 2 days. So as I told the community at 5 o'clock, the best thing for anybody to do right now is to be at home, to minimize contact with fellow humans, basically, and try to self-isolate as much as possible. And I think Annette, who has a better credentials than I in terms of health management, will probably repeat that. So that would be my advice to us and the community, that if you don't have to get out and if you can work from home, that's what we should be doing. Because a lot of the cases that they have diagnosed, or not diagnosed, but have confirmed, and when they're calling people, the reasons people have caught the virus is because they were at a restaurant, at a party, creating their own party with a group of people. The bars are closed now, but a lot of them were from being at bars. So we have to remember the basics that we talked about, and Annette will talk about tonight. So that's my opening comments for now. We're going to have Annette do a nice thorough overview, and then we're looking forward to hearing from Hillary as well.
Good evening, Mayor, Council. So glad to be here with all of you. I did want to share with you my my measuring stick. So, in case I forget what 6 foot is, it's a little bit taller than I am. So I'm almost 6 foot, but people don't realize that. So with heels anyway. So, but you know, I think we all kind of forget the 6 foot distancing, and so we get too close to people because that's human nature. You know, we're humans. We like to be close. And so I wanted something to remind me, what is actual 6 feet? And 6 feet is actually quite a distance. You know, it's not close, it's far away. So if you could do 6 foot, 10 foot, 12 foot, even further, or stay at home, like City Manager Zanoni said, that's even better. But this is 6 feet. So. I'm using that for my restaurants. So we're going to get started with the presentation, and I'm just going to give you a little overview of where we are with COVID-19. I think they're going to pull that up, but while they're pulling it up, I'm going to start with the total positives that we have since the beginning to today, 4,917 total positives here. And like City Manager Zanoni just mentioned, CDC is basically saying you really probably have closer to 10 times that amount. So 5 times 10, so 50,000 so positives. is probably closer to the right number, because there's all these people that haven't gotten tested, or they don't know that they're sick, so there's all of these things going on there. But today, we hit an all-time high of 445 positive COVID cases in one day. The hospitalized, again, is 302, in the ICU, 103, and recovered, 491. Hospitalized includes all three hospitals, Shoreline, as well as HCA, as well as Driscoll. Next slide. I put this in here because I think it's important. People are asking about the positives. Are positives being reported to the health district? It's a law. The Texas notifiable conditions have included now the coronavirus, novel coronavirus, as you see there boxed in, and it says that it must be reported immediately. And so every COVID-19 case that is within our jurisdiction should be reported to the health district. As soon as that physician receives it, they should be reporting it to us immediately. Next slide. So the health district started our drive-throughs. We received some nucleic acid, and so for our testing capability to be able to analyze the test in our laboratory. And so we started the testing again, our drive-through yesterday, as well as today. And yesterday, we actually took 112 individuals through. We actually called 200, 112 people showed up, and there was 30 positives. So it was a rate around 28%. Today, 109 people went through the drive-through, and there was 39 positives for a rate of 36%. So we're saying we have a positive rate of about, on average, around 30%. So just kind of looking over time at all of the different drive-throughs. We are trying to stay on a schedule for the health district for Tuesday, Wednesdays, and Thursdays, as long as we have the resources to be able to do that and keep doing these drive-throughs. It is at our Horn Road site, 1702 Horn Road, and it is by appointment only. And our number is 826-7200, option 2. Next slide. I guess going back to the last slide for a second, I do want to say that we are practically caught up. We had like 3,000, what we call PUIs, people that wanted to get through the drive-through. We've given over 2,000 to the county, because the county is actually helping with some drive-throughs as well. And the rest of them, we've been trying to do them. We've also called people, because we do the reverse alert, to find out, are you still interested in going through the drive-through? And so some of them have said no. We've already gotten taken care of somewhere else. And so we're pretty much caught up. And I say pretty much because every day we get about 400 or 500 people that want to go through the drive-through that call us. And so we're putting those people on a list, and we're telling them we're going to be calling you every time we have a drive-through. Make sure you answer your reverse alert and come to the drive-through. So, next slide. So the COVID-19, our lowlights. This isn't our highlights. These are our lowlights. Our highest hospitalizations was as of today, 302. July the 2nd, it was 185 patients. Just wanted to show some type of comparison here. Our highest ICUs were again today at 103, compared to July 2nd at 55. Our highest week with positive cases, the week ending July 3rd at 1,773. I'm more than certain this week will be higher than that. And June 20th through the 26th was 951. The highest day with cases, again, was today, compared to July 2nd, 262 cases. The highest deaths in day were yesterday and today, 8 cases each day, for a total of 16 cases. We've had 35 deaths in Nueces County due to or related to COVID-19. Our condolences do go out to the families and the friends of these people that we have lost to COVID. Next slide. So the symptoms we all heard early on were fever, cough, shortness of breath, altered sense of mental status, fatigue, chills. The new symptoms, which we're seeing, they're more like flu-like symptoms. We call them ILIs, influenza-like illness, sore throat, congestion, allergy-like symptoms or flu-like symptoms, altered sense of taste, loss of sense of taste or smell, intermittent symptoms, nausea or vomiting, diarrhea. Next slide. People of any age with the following conditions are at increased risk. They're considered the vulnerable population. So if you have COVID-19 and you have diabetes type 2, you could end up in the ICU. If you have COVID-19 and you have COPD, chronic obstructive pulmonary disease, or any type of issues with your lungs, asthma or other issues, you could end up with severe disease. If you have obesity, a body mass index of 30 or higher, and you get COVID-19, you could have severe illness from COVID-19, as well as heart conditions, sickle cell, immunocompromised state, or chronic kidney disease. Next slide. The health district has also been working with Dr. Ram very closely. This is our local health authority. So he has put together some treatment protocols, and these protocols, we've sent them out to the nursing homes, the state schools, the assisted living facilities, as well as the jail and the annex. So these protocols basically say, if for whatever reason we get to a point where maybe there's not an ambulance available, or maybe you can't get to the hospital, or maybe the hospital doesn't have any beds, you can start these protocols, these medications, to try to help that patient at the bedside. And so we put those standing protocols in place. All of the nursing homes were on a conference call with all of us. They understand the reasoning behind it, and so they have them just in case. Next slide. It's everywhere. So how do I stay safe? We know that, I said 4,000 cases. How many are active? How many do we actually have? According to CDC, the tenfold. So stay at home as much as possible. If you don't ever get exposed to the virus, you can't get the virus. So try to stay home as much as possible. So stay at least 6 feet from each other who are not part of your household. So if these are strangers, these are people that you don't see very often. Maybe they are family members, but you haven't seen them in a year. You still need to stay 6 feet or more away from these individuals. Wash your hands often, with soap and water preferred. A lot of people are using the hand sanitizers. That's going to take away a lot of your good protection that you have. Those are to use like you're just coming from the mall, you used your credit card, you're doing a lot of touching things, you're touching door handles, use your hand sanitizer. If you're at home, you can use soap and water. That is the best protection from germs, soap and water. Avoid large groups of people that you do not know. Always wear your mask in public. Stay away from sick people if you are sick. If you're sick, stay away from everyone. Next slide. So for the general population, if you are a COVID-19 contact to a known positive, so I just heard that so-and-so had COVID-19, and I was at that same restaurant with them, and we were at the same table eating together, I have to go into a mandatory quarantine for 14 days. That's as simple as can be. Mandatory 14-day quarantine. Where people are getting confused as they're saying, I was a contact, but I went ahead and got tested, and they told me I'm negative, so I don't have to stay. No, you have to stay in quarantine. The incubation period is from 2 days to 14 days. So even if you're negative at day 7, you still have to finish out staying at home in quarantine. That's mandatory. The next is, I was just diagnosed with COVID-19. Do I have to be in isolation? Absolutely. It's a mandatory 14-day isolation. That's mandatory. So you have to stay the entire 14 days. Next slide. So employers have a lot of questions because, we're opening back up and they really need their staff. So they're saying, what can we do? So here are what employers' do's and don'ts. So do send your COVID-19 positive home. If they tell you I'm COVID-19 positive, go home. In fact, what we tell our staff is if you're starting to feel sick, you don't talk to me until you're halfway to your car in the parking lot. Don't come over to the office to tell me, you need to be walking out the door telling us. So sometimes it happens right in the middle of their workday. They start feeling like they have a stomach ache or they're getting diarrhea or they feel like they're getting chills. Start walking out the door. We do not need you here because if you get anybody sick, we're all going to be sick. Do contact trace the contacts, which means, so I know so-and-so was sick at my office. I also need to figure out who was that individual close to. I'm doing that. I'm the employer. I know what shift I put her on. I know who else she's been in contact with, and I'm talking to her as well on the phone. Do send your contacts to the positive home. So all of these people, there were 7 of them. They were all sitting with her over there at the phone banks, and they weren't social distancing. You all get to go home. So you get to go home for 14 days to quarantine. Make sure you don't get sick. Do thoroughly disinfect the office. Everything that they've touched needs to be disinfected. Need to wipe everything down, clean everything up. I'm talking about restaurants, I'm talking about bars, I'm talking about doctor's offices, I'm talking about all these places where we've had positives. We tell them the same thing. Disinfect from top to bottom. Do develop a COVID-19 plan. Okay, this is now July. You should already have a COVID-19 plan in place, and you should have triggers next to it. If so-and-so gets sick, an employee, we're going to do boom. So everybody knows what you're going to do. So you need to have a plan. You need to know what your organization looks like and how the plan's going to work for you. Do not, if you're an employer, do not ask a COVID-19 to come back prior to the 14 days. Oh, you're well? Come on in. We need you. No. It's mandatory that they stay home for that period. Don't require the staff to get retested to come back, okay? CDC pretty quickly back in April said, you do not have to have 2 negatives anymore with 24 hours in between or greater. You can do the non-testing symptom strategy. So if you're getting well and you're not having fever anymore, then you can actually go back to work. And it's those 14-day periods, so we tell them on day 15, they can go back to work. Don't ask staff to get proof that they tested positive. They don't need that. So there's no reason for it. They told you they're positive, they're positive. If you don't believe them, because we tell them, tell your employer that you're positive. You have to do that. That's the only way we're going to stop this spread. So if you don't believe them, you can call the health district and say, I'm just verifying. So-and-so said they were positive. Yes, they're positive. Okay, thank you. That's it. That's all you need. And don't require a letter or a release letter to go back to work. CDC said that since the beginning. If you're requiring them to go get a letter from a doctor, the doctors are extremely busy right now. There is no reason for them to get a release letter. The recovery is a certain way, 14 days. On day 15, they can go back unless they're still sick, which they shouldn't be at work anyway if they're sick. Next slide. Some of the surveillance that we're doing at the health district of the places that have 2 or more cases are the nursing homes. Currently, we have 10 nursing homes that are under monitoring. That means we're working with them. We're making sure they have their standing order protocols. We're looking to see if they're quarantined, they're detecting, they're isolating, they're moving patients, separating them. Everybody's wearing their PPE. So we have these that are there. The Corpus Nursing and Rehab, Robstown Nursing, Vista Del Mar, Cimarron, Retama, Trinity Towers, Focused Healthcare, and River Ridge Nursing and Rehab. We also have assisted living facilities. We have 5 that we're monitoring, and those are there as well. The Viera, Villa South, Ellen, St. Benedict's, and Villa Northwest. Next slide. The convalescent plasma, I'm happy to say, is going much better. The judge has taken that on as kind of her own project, and she's working really hard to get individuals to come in. We are offering $50 gift cards. The city and the county got together, purchased these gift cards for $25, and then they had a match from L&F that said that they would match that. So they're giving $50 gift cards to whoever comes in that has already recovered from COVID-19. They can come in to the blood bank. They can donate their blood. The blood bank will turn it into the plasma that they need, take it to the hospital, and they'll give them the $50, and they also give them a really nice T-shirt that only the COVID-19 people can get, and it says, I saved 2 lives today. So the COVID-19 patients have donated. It's over 228 pints of blood now, and they have also imported 318 pints of blood from New York, from Minnesota, from many other states to give to our COVID-19 hospital patients. What is the monitoring resolution of symptoms that I mentioned? And I'll just, they're right there. It's the fever. You don't have fever for at least 3 days. Your other symptoms, your respiratory symptoms are improving. Your cough's improving. Your shortness of breath is improving. Plus, it's been at least 10 days have passed since the symptoms first appeared. So again, if you keep to the 14 days, you can let them go back to work on day 15. Next slide. And that concludes the presentation. If y'all have questions for me.
Well, should we have Hillary, or should we, well, that way,
can.
you can answer your questions, and then if you need to leave, you can, or,
Okay, or either way, I can wait, or you can do Hillary, and then if y'all have questions for either one of us.
yeah, let's have both presentations, if you don't mind, and that'll help us. So,
Okay, Hillary?
While
As a what?
Hillary's coming up, can I just add one thing to Annette's, that we've added 12 additional staff members, right, to help. The mayor was encouraging us and helping us to do this, so we added 12 additional to the over 100 that's in your department to begin with, to help with contacts tracing, getting data from persons that are recovering, and so that's been helped. They're on board now, the training, and that'll help us with our data collection and contacting people, so,
super.
yeah. Yes.
Good evening, Mayor, Council members, thank you. I apologize, I don't have a presentation. Our organisation are literally having it handed to us right now. We're working day and night. I cover Laredo and the Rio Grande Valley as well, so I have 44 hospitals and upwards of 250 EMS agencies. So you can imagine what's going on in our world right now, and we have 7 staff. So I just wanted to let that be out there. As Mr. Zanoni indicated, the testing positivity rate for the last 7 days for the state is at 15%. And as of 5 o'clock today, the State Medical Operations Center released a report indicating there were only 1,017 ICU beds available in the whole state of Texas. So if I'm here because you're concerned, I would say, can you hear me? 1,017 ICU beds in the whole state as of today. So if I'm here because you're concerned, I think your concerns are very valid. The situation has changed rapidly in the past week. Our hospitals are nearing capacity, but I do want to let you know that we do have plans. So I'm going to go through a few steps and just let you know what's going on behind the scenes at our organization and with the hospitals and the EMS agencies. As you all are aware, we monitor the hospital provided data on a daily basis. They update their data twice daily to indicate across a slew of different bed types what the availability is in the hospital, how many ventilators they have available, how many ICU beds they have available, and so on and so forth. And so we're watching those closely, and we share those with you on a daily basis. We've pretty much exceeded our regular surge planning. We plan for incidents typically like mass casualty events, whether that's a bombing or a terroristic event like the Boston Marathon or something like that. It's typically an event that we plan for an initial surge at the hospital where you get a massive influx of patients at once. EMS are working to distribute those patients appropriately and, appropriately not to overwhelm any one hospital at the same time. And those types of events are usually over within a matter of, day or two. Things start to come back down. Patients are still hospitalized, but the initial surge is over with. We all know now we're in a completely different ballgame now. Nobody really saw the, prolonged situation we're in coming. But our hospitals, although they're at nearing capacity here in the Corpus area, they're working feverishly to create beds. Beds are not really the main issue right now. Staffing has become the issue. And through our defined processes with the state of Texas and our local and state partners, we have been requesting resources by the means of staffing and now equipment that they are providing to our region, and we're able to push those resources to the hospitals to enable them to staff the beds that they have in-house. So due to COVID and COVID-related absenteeism at the hospitals, they're not able to staff those beds right now. So by bringing in those extra resources, they're able to create more beds, more ICU capacity, and so on and so forth. So kudos to the state of Texas for helping us out and provided all of the resources that we've requested so far as staffing and equipment goes. I will say that they do have some ventilators that they push to us already, 40 for the whole of Region 11. And we have the task of prioritizing where those ventilators go. So it's a drop in the bucket. It's not a lot. I need you all to be aware of that. We have the ability, they're tasked to my agency, so we have the ability to assign them to a facility, but also if they're no longer needing it or using it, move to another facility. So we can move those around and get them to where they're most critically needed at any time. Alternate care sites, we're looking at, alternate care sites for, overflow if we do reach that point at the facilities where we no longer have the space in a hospital. I know hospitals in San Antonio right now are using cafeteria space to create bed space. The thought process behind that is so much easier to create more space within your facility where you have all of the services and wraparound services in place rather than try and uproot everything and dilute what you have in your hospital system and move it to another facility. But as a last resort, we do have plans in place to do that. And we're also working with all the hospital systems. We're working with Christus and HCA and Driscoll to facilitate, moving patients to, other facilities when we reach those critical points, and utilizing space that they may have and beds that they may have at one facility over another to make sure we can care for our community. EMS. I have to say, I've talked to Chief Rocha today. We had a really good conversation. We are talking through ideas and plans to prepare them for what's currently happening in the Rio Grande Valley. Over the last week, we have upwards of 8 hours of wait time at ERs. And 2 days ago, we had 8 patients were actually, after upwards of 8-hour wait at the ER outside in the ambulance, they were sent home. And ultimately, a day later, one of the gentlemen who was sent home, who was 95 and COVID positive, passed away. So the situation is dire down there, and I don't think we're so far behind them. Maybe a week or two. The TAM UCC group are doing all the predictions for you. They've predicted the need for, more ICU bed capacity, which we're working hard to create. I also wanted to just touch on the fact that everybody wants to know how many beds. Every day these numbers change. They actually change hour to hour. So you imagine being in a hospital, you're having people coming in, but you're also discharging people. People are getting sicker and going on ventilators. People are also simultaneously getting better and coming off the ventilators. So focusing on these numbers on a daily basis, yes, it gives you a snapshot, but it only gives you a snapshot for that day, for that hour that they were captured, to be quite honest. And defining a number of beds that, we can surge to right now is such a fluid situation. So just know that they are working to create as much space, as much bed capacity, and, to be able to take care of as many people as possible, provided all of these external resources are still available to us. We will be able to create as much space as we can. The Medical Society have been willing to assist us. My organization have recently facilitated federal teams on the ground. We have disaster medical assistance teams, DMAT teams on the ground in the Rio Grande Valley. They're going to go operational tomorrow. We have them in Laredo as well. And they also stand ready to send their assessment team first to the Corpus area should we need it, or the Coastal Bend area should we need it. So know that they're staged here already, and we're working directly with the feds to keep them here, justify the need, which everybody knows is I don't know if you're watching the news out of the valley and what's going on, but it's dire down there right now. So if anybody has any influence with the governor and the governor's office, I think a good idea, it would be a consolidated suggestion, maybe in a letter, to say, hey, how about getting us the USS Comfort or the USS Mercy to the Gulf Coast area, because Houston are in pretty much the same situation as we are. Those ships have 1,000 beds and they're fully staffed, and they could move up and down the coast. And we have a fleet of ambulance buses in the state of Texas. We have 15 and each of them can move up to 22 patients at once. So it's just something to think about and possibly float the idea if you have any influence there to get someone's ear and push that idea up, because the ships could move up and down the coast, and we could definitely, as the surge goes, and the Port of Brownsville as a deep water port, we certainly are, and Houston certainly is. So it's just something that came up on a state call today, and I think something maybe worth someone who has some clout, maybe getting someone's ear. With that, I think I'm done. I again apologize for not having the presentation, but that's kind of the situation we're in right now. Just know that everybody's working hard, everybody works together. We bring all the hospital systems together on blue sky days to prepare, on an everyday basis to make sure patients get to where they need to go. We write the regional plans, and then we prepare for these types of disasters through the hospital preparedness program. So I'd be happy to sit down, and if you have questions for me or Annette, I'll stick around.
Well, thank you very much.
You're welcome.
We've got 3 council members, 1, 2, 3, 4, 5, 4, I guess, out in the cloud somewhere, and we've all got numbers here. We can punch a button. So before I get to, and Gil is the first one that's lit up here, but before we do, since they don't have numbers, I'll just call a name, and if you've got a question or comment you'd like to ask, if you wouldn't mind doing that. Michael, are you on and have any particular question or need some information?
Yes, sir.
Go ahead.
I have a question. You were asking us if we were able to contact the governor. Could she repeat what she was saying about the state conversation about bringing these ships down here that could house 1,000 beds and move them up and down the coast between here and Houston?
It was just a suggestion that came up on our state hospital preparedness call today. One of my counterparts out of the Houston area had made that recommendation that maybe the state themselves, the Department of State Health Services, or anybody else could, start pushing that idea up to the federal level to see if that was a possibility of getting, the comfort or the mercy.
What were the exact names?
Excuse me?
What were the names of the ships?
I believe one is called the USS Comfort, COMFORT, and the other one I think is the Mercy.
The Mercy. Okay,
Mercy.
thank you.
Yeah, you're welcome.
Okay. Roland, you out there?
Yes, sir. Yes, sir.
You have any question or anything?
I guess, first off, thank you, Hillary, and thank you, Annette, for all the work that you're doing. We can't express how much we appreciate you for what you're doing. Backing up a little bit, Annette, is a flow chart been made available to, I guess, employers so that way they know exactly what they can do, or is it on a website? Or Peter, have we done anything like that so that way we can? Because obviously, employers are lost also, and we need to make sure that they understand and that we make that information available to them. That's one. And then the other thing is I know we were in receipt of some CARES money. I just want to ensure that we're spending every dollar that we can to in any capacity possible to make sure that we're doing anything to combat this or to educate the community.
So in response to the employers, we do have it on our website, on our Corpus Christi website, as well as our county website, because we do have that link as well to DSHS and CDC. And so they have a very, very nice area that you can go to on coronavirus for employers. And you can go of your retail business and you can click on it, and it has the plan, and it tells you basically all these things that you should be looking at. Your sick leave, you should be looking at, when employees are out, when you're running out of staff. So all of these things are in those plans. And so I think it's a really good template for them to go by, and we do have that link to it and on our Corpus Christi website as well.
Thank you. Thank you so much.
Okay. Ben?
I'm here, and I've got a few questions for Annette and another comment.
Okay, go ahead.
I guess I'll start with a comment for City Manager Zanoni and Annette. I've had several organizations reach out and offer their space because they have buildings that are not in use. And so they have facilities that they've offered for extra beds or even storage if the need arises. So we have community members that are willing to help where they can. And for Annette, do we have a count of how many people have tested multiple times? I know that we have, let's say, 1,000 tests done in a day. And out of those 1,000 tests, could some of those come from people that maybe this is their second or third test?
It definitely could. That's a great question, because some are still going by the testing strategy to go back to work. And so, like if they're working at a nursing home, while they realize that CDC doesn't require that you have the 2 negative test, you can actually have the non-testing strategy, so you recovered. Some of the nursing homes still want to, on an abundance of caution, make sure, and so they say, I still want 2 negatives. And so they will come back multiple times to try to get a negative. And so you may see them come back 2 times and they're still positive. We had one individual that she got sick in March, and she was almost to June, and she was still testing positive. So yes, you're right, we do see that. We have always tried to take those out. We don't count them because it's not another positive. It's the same positive. They just still have a low virus load that they're carrying. But it just happens because they're trying to get back to work. And so, but we do look at those. It's harder to look at right now because we have so many, but we're working with the city's IT, and we're going to redact all of the HIPAA confidential information, and so then they could make it easier to pull out those names and the date of birth that match, and then they could pull that data out as well. So.
And I guess a follow-up to that is, are we keeping track, or how do we keep track of those who have recovered? Maybe they've already been quarantined, but once they have recovered, are they reporting back in any way?
So what we're doing is we have volunteers, and some of our staff are assigned to recovery. And so every day they go to the furthest back that they can go where we're at. And so they start on the older COVID positives, and they call them and they find out if they meet the criteria for recovery. And if they do meet the recovery criteria, they're letting them know that they're released and that they can go back to work. So we also have a formula in the system that shows us that these ones are at their 14-day quarantine, and that we can go ahead and call them to find out if they're recovered.
And I guess my last question is, have you noticed any patterns from private labs that maybe they're having a lot more either false positives or false negatives? Is that even an issue, or is that just having to do with the incubation period?
No, they aren't having those issues anymore. They were early on with antibody testing, but we weren't, that's not anything that we were allowed to count at the beginning. And later on, like in the last couple of weeks, we have been allowed to count antibody testing, but only if it meets the DSHS criteria, which is that it can be antibody positive, either IgM or IgG positive, but a clinician has to also diagnose it as COVID-19, or they have to have an EpiLink, which means that they've traveled somewhere where there's a lot of community spread, or they've actually been exposed to a COVID-19. But if you look at our numbers, our 4,917, we only have one of those for antibodies. So antigen swab is kind of more the newer test that you're seeing out there. So they're actually doing a swab of the nasopharyngeal, so it looks just like the ones that we do. It's still PCR. It's just called an antigen swab. It has a very high specificity, which means that if it's positive, that's a really good test. It's going to be positive if you did PCR. If it's negative, it doesn't really tell you anything. So if you notice, like Physicians Premier, if they do the antigen swab and they get a negative, they already have the protocols in place where they automatically do a PCR test. If the PCR test comes back positive, then they report that to us. So a negative for an antigen swab tells you nothing, but a positive for an antigen swab is going to be positive PCR. And so we accept the antigen swab as PCR positive, and we take those as well. We've really just been taking those like in the last week, though.
That's all I have. Thank you very much.
You're welcome.
Greg?
Yes, thank you. First, I'd like Annette and Hillary, thank you so very much for all the hard work you're doing. It's so important.
You're
You're
welcome.
saving lives. I can't thank you enough. I'd like to express my condolences to the 35 Nueces County residents, the family, for that with it. It's just such a sad thing. But to staff, with the positive ratio on there, that on our website, we list our cumulative positives on there, which doesn't tell us a whole lot because that goes back into March. Could we have a 7 or a 14-day moving average which would give us a much better snapshot of where we're sitting today? So if we're running 30% positive ratio over the last couple of weeks and we look at that 16% cumulative number, again, it's not a good snapshot with it. And then on that, we talk about comorbidities on there, and I was just going through, this is health district information, and it's a little bit dated. So 31% of our population would be 14.5% diabetic, 13% were over 65.
Excuse
That doesn't
me,
include
Greg?
Hypertension, COPD, heart
Greg,
disease,
can you
chronic
hear me?
kidney. So would a 50% could, is that a reasonable estimate that 50% of our population has?
Was the question if it was fair for 50% of the population in Nueces County to have comorbidities? Is that a fair analysis? Was that the question?
Yes, so that is on there.
I would say yes. I think that's conservative. So, but yes, at least 50% of the population.
Okay, so when we see these reports and, oh, they had a comorbidity, well, half of our county has a comorbidity.
Absolutely. Yes.
Okay. And Hillary, I want to thank you so much for your candor with it on there. And so here's some of the things you said. And again, thank you for the honesty, because that's what we need to hear as a community. We've exceeded our surge planning. You mentioned DIRE twice. Ventilators, it's a drop in the bucket. Some communities are going to overflow in cafeterias. 8-hour ER wait, and we sent them home on there. That as we go out, and there's still some in the community. My wife was at HEB today shopping. There was one person without a mask on that. And to hear this kind of information, how basically desperate we are. We're on that path in New York City or New Jersey in our infection rates, our overloading in our hospital. I'm glad that you're telling it like it is on there with it. And, 3 months ago, we went through a lot of pain in this community, shutdowns, when we were a fraction of where we are today. And Mr. Mayor, I fully support anything you do to help keep this community safe. Any kind of regulation, other type of thing, to stop this spread. And one last thing, the number was mentioned, possibly 1 out of 8 in this community right now have that disease. I went by Walmart today, 200 cars in the parking lot, so there were 200 people in the store. What does that mean? There are probably 16 people in that store infected, walking around, touching, going through checkouts, things like that with it. And just stay home, stay safe. Thank you, Annette, for what you were saying. That's the safest way to be. I'm at home for a reason on there with it. And we as a community, that it's all of our individual actions and how important that we do listen, we do those fights. Again, thank you, Hillary. Thank you, Annette. Thank you, staff. That's it.
Thank you.
Mr. Mr. Hernandez?
Thank you, Mayor. With regards to this, when somebody tests positive, is still the protocol to send them home and to self-isolate?
Yes.
Is there any recommended treatments that they're telling them to do prior to hospitalization?
So what we're doing currently is we did the standing protocols for the nursing homes and the other facilities I mentioned. We have also written out scripts Dr. Ram wrote, and they're for low-dose steroids. And that, again, is if they're just in a pinch. They can't get into, all the ERs are full, the ambulance are too busy to pick them up.
Okay, when you say steroids, are you talking oral steroids,
Yes.
injected steroids?
No, oral, Decadron and progesterone.
Okay,
So-
there's been studies that inhaled corticosteroids are probably the preferred method to target the specific area in your lungs to protect your lungs from this virus.
Right.
So do we have any protocols to have that in place in combination with probably an antibiotic to prevent pneumonia?
That's a great question, and I've seen those articles. I have not read those studies, but Dr. Ram suggested that a low-dose steroid at this time would be best. He could actually switch that over, though, to like an inhaler like you're talking about. It's for an antibiotic as well as an anti-inflammatory.
Well, there are other, I guess, other doctors in Texas using, a budesonide with an inhaled nebulizer in
Right.
order to target the actual lung, protect the lungs from the work, and that's actually done before
Right.
you go into a hospitalization.
Right.
Is there anybody that does that here, or are we recommending that to anyone?
I have not seen that recommendation, but that would be Dr. Ram as our local health authority.
Can you look into that?
I
Because I
can.
think if we can prevent people from going into the hospital by having some form of treatment beforehand, I mean, from what I'm seeing, you could do everything right. Wear your mask, wash your hands, have the social distancing, and still get this virus. Is that correct?
There looks like the.
I mean, there's no guarantees that
Right,
whatever
there's
you
no
do.
guarantee, so you're
there's
wearing
no
your mask,
guarantees.
right? There is no guarantee.
So, I'm of the mind that we're going to have to deal with this for the long term until we get that herd immunity thing. But we should look at treatment options and have something that we can recommend to local doctors in order to be doing, so we can actually have something before they get into the hospital. If you can, please look into that. I've also read on some possibilities for anticoagulants as a antiviral or inhibitor. Has any thoughts or work been done onto that, or recommendations?
No, I have not heard any of that. So I've heard the low-dose steroids, and to be honest with you, that was very scary for everybody, just even having those conversations. We even had a call from the state saying, are you really going to do this? And we're like, yes, we're really going to do this. We're going to do whatever we can to save lives. This is a low dose, but we, like Councilman Smith said, we have a high population with a lot of comorbidities. And so you're taking a chance, because we all know steroids actually can increase insulin. And so it's only a 5-day.
Right, because it suppresses the immune system, right?
So,
And I'm curious
yeah,
as to
sure.
why you're doing an oral steroid, because that would affect the whole body, not necessarily the targeted area like the lungs, which is, I'm assuming that's what you're trying to target.
So, again, I'm taking the advice of the infectious disease specialist, the physician, the local health authority
Okay.
for New
So-
Orleans County.
I guess, and
But I
maybe
will
this is a
ask him.
question to Dr. Ram, is to, if we can improve our treatment on the early stages as opposed to the back stages when people are in the hospital, on a ventilator where they're already getting damage to their lungs, I think would be a much better thing. The last thing I have, and again, thank you guys I know you guys are working late. I understand that, and I appreciate that. There's some areas of the websites that aren't updated, and I understand, the age, the gender type things. Do you know when we'll be able to get that back up and running?
Yes. That's supposed to be, I think by tomorrow is what I heard. I heard Thursday or Friday. So it should be ready to go. That was the information that I was saying, that IT was going to take all that and redact the HIPAA confidential information, and then they'll have the zip codes, they'll have the ages, they'll have everything else that they need. They can start reporting that out as well.
The questions I gave you on the corticoid steroids and the I put it in an email earlier today. If you
Okay.
could just forward that to
I
Dr.
sure will.
Ram and
I
see if we
will.
can get some information
I
on that.
apologize, I
ju-
didn't see
just-
that yet, but I will, I'll send it to him. So I'm not a physician, so I have to rely on him.
No, I get it. I'm not a physician either. I'm just trying to do homework and see what the best
Yeah.
we can do
I've
to
been-
do early
We're gonna
treatment.
keep y'all from getting sued for
Thank you.
practicing medicine without a license here, so
That's right.
No, I just
don't want-
asking a question. What can we do to recommend
Understand.
early treatment?
I don't want my license
Good
revoked
questions.
before I even get one.
good questions, Mr. Roy.
Good question.
Thank you. Again, I want to thank you for your work and your staff's work and dedication and being honest in terms of your assessment. Also, I want to expound a little bit on what Councilman Hernandez said. In terms of, I know you mentioned Dr. Ramp, he's an infectious disease physician, but each of the hospitals also, how involved are they in terms of their pulmonologists? I know we have pediatric pulmonologists here in the city, and how active are they in terms of looking at and suggesting treatments? I imagine if you get admitted to a hospital, then that attending physician and it's still the same process, right?
Yes, absolutely.
So
They're very active. Dr. Ram is just an extra consultant. And so on all the COVID-19 cases, whether they're Nueces County or otherwise, he's actually going and actually either doing, he's kind of moved over now to doing some telemedicine, but he had been doing bedside medicine up to the last couple of days.
So those hospitals are actually talking to each other in terms of protocols and looking at best practices and things that they can do as far as trying to make sure that we do anything we can to prevent the number of deaths that we have.
Absolutely. So even the Driscoll infectious disease physician, Dr. Jaime Fergie, he's involved as well, trying to help with, anything any articles that he has, any assistance that he can be to Christus or HCA. He's there and available. And so they're all talking to each other, and Dr. Ram's talking to his colleagues in different states, just trying to make sure that he's using best practices. I will say that this time he says it's different. He says that the first time the convalescent plasma seemed like it was really recovering people quite well. Within 3 or 4 days, he was able to turn around and they were actually able to leave. This time, that's a struggle this time. So it has like a lag for some reason, and he doesn't know if that's because of this other respiratory issues that are going on, but there's a lag in being able to get them recovered and to get them moved out. So you're seeing longer hospital stays like you're seeing in the Valley and everywhere else. So, and the last 2 days is the first time we've ever seen, we've had 2 or 3 individuals that actually died at home. So we are seeing some changes right now that we know are not good, indications of what's going on.
So my last question is, and I think you kind of touched on that, in terms of looking at the average individual that has the symptoms until, if unfortunately they do not recover, is anybody tracking the average length of time? I know that there's those comorbidities will play into that,
Right.
but are we tracking, let's just say on average, okay, within 8 days, if you get over that 10 to 12 day period and you're recovering, then you seem to be clear out of the woods. Is anybody covering that length of time
Yes.
when it's at a critical mass?
Yes, they are. They're looking at all of that as much as they can. As these numbers increase, it's harder to do, but what we're seeing is that they've just come in recently, like the 1st or 2nd of July, and they're expiring. So on the 5th or 6th or 7th, so they're expiring very quickly now is what we're seeing as well. And so that's very concerning because before we'd have them in, and if they were in ICU, and what we learned from China was if you just kept them alive long enough, they would recover, full recovery, and full recovery to the extent that we know. We don't know what the effect is really going to be long term on their lungs, but they would recover and they could walk out just like they walked in. So, and now we're seeing, the duration before they expire is much shorter.
So one more last question with that. Is there any talk or any conversation at all in terms of the COVID-19 strain that we saw in March and what we're seeing now? Has it possibly, mutated or changed?
I asked Dr. Ram that because, the symptoms were changing, and he says that he has not read anything that it actually has changed at this point. So he does know that it seems like you're seeing flu with COVID-19, which is kind of unusual. You're seeing them together. But no, he says that he has not seen anything that it's actually mutated at this point.
Okay, thank you very much.
You're welcome.
Ms. Wartho?
Thank you. Thank you, Annette. A couple of questions. So if I tested today, how long before and I'm positive, how long before that result shows up? So in other words, every day that we say we have X amount, how many days does that consist of prior to that date?
So if you tested this morning in our drive-through, by noon today, we have your results and we've called you.
And if I didn't, if it was maybe a clinic or National Guard?
Well, that's a great question. It just depends. So the National Guard has gotten to a shorter duration. They had gone to a lab that was taking closer to the 14 days, which was ridiculous, even though these individuals were still asked to isolate until they got their results. So now they're closer to 4 to 6 days for results. So once they get those results, then they send them to the health district, and they send them to everybody else, San Patricio County, all the different counties, and they send the results as soon as we get that line listing, because we wouldn't have any way of knowing that you had gone there.
Right.
It has your name and your phone number, and then we call them immediately. So the day that we get the results, we call them.
Okay, so it's 4 to 6 safely, 4 to 6 days prior to what we're reporting, the results come from there.
That's correct.
Okay. And then I wanted to ask, so is this correct in saying that if someone with O blood type tends to have more subtle symptoms than the others, or have y'all?
I've read that article and several articles basically saying that, but I haven't verified. I will check with the blood bank to see if they have any of that, knowledge, but I haven't heard that. I do know we're short B positive, so a lot of people, and I was looking at the list of the 280 people that had donated locally, and there's a lot of A's and there's a lot of O's and positive and negatives, but there's not a lot of B positives. So if you know you're B positive and you've had COVID-19, we really need your blood.
Interesting, okay. And then can I ask y'all to, maybe if you and Hillary can hold your measuring stick there? I just want to get, when you have 2 people on each end of that, it gives a much better idea of what.
It's not this part.
What's that?
A lot of people say.
Well, a lot of people, yeah, you see people holding their hands out saying, this is the,
6 feet, right.
this is the
And
distance.
I have long arms, but
And,
no.
right, no, this is good, and I hope that the caller times, I don't know if you got this distance, maybe I should turn the thingy up, turn it up, there you go. Well, because that shows a true, the reality of what 6 feet is. So,
It's a good distance.
it's a lot bigger than what we thought. Anyway, ladies, I want to thank you. You guys are heading up. I mean, both of you. It is, what you're doing is amazing. I know y'all are working endless hours, and on top of that, lots of questions that come your way from so many places. So we're really blessed to have you guys. Please don't quit.
Thank you.
Yes, thank you.
Ms. Garza?
Mayor, my words this evening are just to say, Annette, Hillary, thank you very much for the efforts you're doing. I know it seems like a losing battle. The numbers right now are very discouraging and very alarming, and I hope people are alarmed, because at the end of the day, your safety is your own responsibility, and you've got to do the things that are being recommended in order to be able to keep yourself safe. I know I hear all kinds of different tales about the testing, and there can be frustration from some of the testing done with the private folks at the clinics and then your drive-throughs and the time it takes to get the results. But I think your suggestions of basically going into quarantine or isolating yourself until you get the results and know exactly where you're at,
Absolutely.
I think are good for the community. And they're hard to do because you don't know for certain, and you don't want to stop from doing something you know you have to do, but in your own personal life. But for the good of the community, I think that those are good warnings, good suggestions. So thank you very much for your hard work. I really think
Thank
that
you.
the things that you're doing are going to help people save lives. Okay, so thanks.
I appreciate that, and I don't see it as a losing battle. I've been watching the WHO, the World Health Organization, for months now, and you can always go back. You know, you can go from one single case to 10 cases to a cluster to a hotspot, but you can actually go backwards too. We just all have to do this together and we can get there, so.
Well, thank you. I think it's been most informative. And let me, Hillary, you hit on something that I wanted to say, but the fact that you broached the subject really gives me encouragement. What can we do? And you ask really, you know, we need to, whether it be asked to get a medical ship down here or whatever, what can we do as a council or the mayor or the city manager or as a group do to help you muster the strength, whether we're going through the city manager, whether you're using the mayor's office, whether we're using our Tammy Embry and our government relations department? Are we being used to the maximum now? If not, we need to be, because we've got a wonderful relationship with our state representatives and legislators. And let me just give you one example. This was an email that went out at 12:46 today from Todd Hunter, that said, and he sent it to, and I don't know who Rachel is. I think that's somebody at the state. That name may ring a bell with you. Rachel, I don't know who that is. But Todd sent it, so I'm assuming it's somebody within the organization that he feels like can help us. It says, please provide a surge team with comprehensive medical and testing in Nueces County. Our county has had a huge impact of COVID-19 cases. I just conferred with Senator Hinojosa and Representative Ferrero, and we're in total agreement. Thanks for the any emergency assistance. And that was at 12:46 today. And at, when I got a copy, I just said, I expressed my appreciation and support for the request and copied all of those people. And at, what time was this one? At 5:52 today, this was back from Rachel. And said, Corpus Christi Medical, thank you for the understanding the pressure on our hospital to run and working staffing. Here's our newest status in Nueces County. Corpus Christi Medical Center has had 16 staff have been identified by a contractor and are being deployed to Doctors Regional and anticipated by this July 10. Corpus Christi Medical Center also sent another request for 28 medical staff, which has been approved by BCF. Christus Pond, 40 medical staff on site. Another 38 have been deployed by BCF. I guess that's, what's BCF?
Baptist Child Family Services.
Okay.
They're the external contractor
All right.
that are sourcing
And,
the staff.
Christus Pond, 16 staff have been requested and approved. So, I mean, they will respond if we really ring the right bell.
Yeah.
And so that's why I'm saying, use us. That's what we're here for. I mean, it's foolish to have the assets that we have and we're not asked to be used. And we've got some good connections at the legislative session. I mean, Tammy Embry knows everybody up there. Todd and the legislative delegation work together very, very well. And they're just waiting for us to give them a nudge. I mean, I think Todd, I don't know whether he got a nudge or he just saw we had a problem and made the request. But whatever he did, thank him for it. So we're here to help. And I've got a question that Paulette asked, that this is where can we help Annette, or was it, I think it was Annette, Paulette asked a question. Of the tests that are given on a daily basis, what's the lag time between, if you're given a test this morning, when is the answer? And you said, if they're tested by us, we can get the answer to you this afternoon. If they're tested by one of these outliers, whatever they may be, doctor, clinic, or lab, or whatever, it could take, I think you said 4 to 7 days. I think it's 4 to 10 days, if not sooner. So 2 weeks. Some 10 days, yeah. So 2 things I want to ask. One is, what can we do to accelerate the results quicker? Because psychologically, you're driving people crazy. They get tested today, and they are living in fear until they get that result, and they try to get the result, and it's 10 days. I mean, you can drive somebody literally nuts in 10 days if this thing is really bothering them.
Right.
And so we have got, what can we do to shrink that time? And so I think I hit on an answer, but I don't know whether it's the right answer. We went through a big celebration that Christus Pond spent $100,000 or $500,000 on a machine that could do 1,000 tests a day. So if we can get 1,000 tests run today, we can get you the answers tonight. The problem is the test kit. Mm-hmm. what can we do? Is it through the supply chain, through your organization, or is it going directly to the vendor that we can say, we'll cut you a check, here's our credit card, you send us 5,000 test kits. And we've got a guy here, if we can get 5,000 tested tomorrow, well, we can do 1,000 tomorrow, we take them down to Dr. Blow, and he can have results by 5 o'clock. That's what we need.
Right.
How can we help you accomplish that?
So it is the supply chain, because all of the hospitals have that same piece of equipment, or many of them do. So they're all trying to get those same test kits. And so they're willing to pay the price, because like you said, it's important that they know. But I want to reassure people that having the test doesn't change anything. And I know you're right, it does appear, the anxiety around it.
We're fighting a psychological battle as well as a
Exactly.
physical battle.
Right.
And so if we can have a massive impact on the psychological side,
Right.
just by shortening that 10 days. That really, for people that worry, I haven't got enough sense to worry a whole lot about stuff, but there are people that are extremely concerned, especially
Anxiety.
if they're the second person. I run into Everett, and he says, oh, by the way, he said, I ran into somebody that was COVID positive. Then I start getting worried. Well, does Everett? Well, Everett said, well, I don't know. I haven't gone to take a test yet. So if it was 3 days or 4 days ago that he ran into this person, and then he says, well, I'm going to go get a test. Well, then I get to thinking, man, if he turns up positive, what about me? So I get worried.
Mm-hmm.
And I hadn't even started taking a test. And so that could be 5 or 6 days, and then it's another 10 days before I get a response. I'll either be completely through the cycle of sickness or dead before I get the results back.
So, yeah.
So we have got to do something, and I'm saying, what can we do to help you? I know you're doing everything you can, but is there anything that we can do to shorten that time frame? Because if you can give people at least some peace of mind, they can adapt to that.
So I think the short answer is if they have the financial ability to go to a private, like a physician's premier,
But that's still taking 4 or 5 days.
And on the military testing teams, the MTT testing teams that resulted from the governor's order to test 1% of every county. And the capability wasn't there because the health departments, if they were lucky enough to have a health department, were already overloaded with the amount of tests that they were currently conducting, right? For the counties that don't have a health department locally, they are overseen by DSHS regional. So in our case, it's Region 11, that's Coastal Bend, Laredo, and the Rio Grande Valley, and their office is in Harlingen. And they cover like Clayburgh County, all the Aransas County, all the counties that don't have a health department. And they were overloaded as well. So governor made that request, 1% of every county needs to be tested ASAP. So we pulled together, not we is not me, it's a collection of 3 different agencies came together to facilitate that and make it happen as fast as possible. So Division of Emergency Management, the Emergency Medical Task Force Program, and the military teams came in. And they've been providing that testing. And basically the way that it's been purported is like we're building the airplane as we go and we're going to scrape some paint. And unfortunately the test results have taken, as you say, up to 10 days and sometimes even up to 14 days because they were trying to distribute the load of the testing, the swabs and the samples throughout the state. So there's people flying planes every night picking up these test kits, flying them to labs. There's people working behind the scenes trying to make sure that we don't overload any one lab at the time. And they're bringing on more labs, every week. There's quite a process that a lab has to go through for that. And then going back to the resource requests that you were talking about and how you can help. It's always, great that people can reach out, straight to the governor's office. But I'm going to tell you, he's going to push it back down to the state and the operations center, where he has a whole team of logistics people, and he has this team of people sourcing staff, as logistics people are sourcing PPE. And it's great that, there's channels that are available to utilize. It's not going to change what they're able to source and push to us. They'll only be able to push to us what they can procure, as far as PPE and staffing goes at the state level.
All right, so
I think if there's anything that comes up, I would be happy to keep you abreast of things like we've already alerted all the elected officials and everybody in the Rio Grande Valley to please come together and write a letter saying that, you know, they really, really need the FEMA ambulance contracts activated at the state level. And so they're coming together with one consolidated message with a plea basically from the Valley to say, please, if you can, activate the FEMA contracts so we can get more ambulances down there. My organization has organized 25 ambulances and an ambulance bus down there, and they still cannot keep up with decompressing the hospitals and moving people out. And so I would be happy to reach out to you, knowing that you're, you know, willing and able to help us if there's anything that arises that we can get ahead of, just for this region.
I think to me, the quickest help, I can't do anything about hospital beds or hospital rooms or anything like that, or because that's way above my pay grade. But if we can get, I mean, we've got a machine here that can do 1,000 tests a day. Anything that we can do to accelerate getting the kits, whether we just go, do we have to go through your organization?
It's a
Can we
supply
go
chain
directly to
issue.
and I understand,
Yeah.
understand the supply chain. Everybody in America is wanting those same kits,
Right.
so I understand that.
Right.
But I mean, but I would have thought by now, throughout the United States, and really the world, that they would have had some type of increase in capacity to meet the demand for these tests. That's what's kind of boggled my mind. The ingenuity and the American creativity is just, maybe I'm expecting too much, I don't know.
If I may, we also get testing from outside, from all over, that we use our equipment on.
Well,
Isn't that
I'm not
correct?
sure, I'm not
No,
sure
but
that
that
the
would bog up some of the, like what you're saying. If it was just exclusive to Nueces County, I think what you're saying, you know, should be happening, but they get tests. What do they call our lab? We're a designated
Right.
lab, if you will. So we're getting tests for our machines to be testing from many places, right?
Well, if that's the case, then the machine that you have or Spawn has, I mean, if I got 100,000 test kits and you got a capacity of 1,000 a day, then you're no better off. But is our testing capacity being used to the fullest right now, just Nueces County or with the load you've got? You got 1,000 a day. Are you testing 1,000 tests a day?
No,
How many, 500?
probably around 200-300 a day.
All right, so we've got 800 capacity that's just sitting there.
Right.
Whether it's from Nueces County, San Patricio County, El Paso County, I don't care where it comes from.
Right.
You're using 20% of your capacity. So what I'm saying is, how can we get the test kits to fill that 80%?
Right.
Now, the other problem is, how do you get the people to administer that 80%? But I think you can find the people. I mean, those tests, I've seen it done, I had an experience. It doesn't take much just to stick that little swab up your nose.
Right. And the VTM, we're on a standing order, so to speak, that every week we get 750 of the swabs with the test tubes that we distribute to the community. Whoever needs them, they can utilize them. It's the back end, the analyzing of the tests, where you're right, where we have our limitations because we have a limitation in the resources. So
Well, anyway, give that some thought, and if we can figure out some way to help expedite and accelerate that and reduce that time, I mean, if we reduced it from the 10 to 14 days down to 3, I mean, that would be a home run. I'd like to get a grand slam so you could get it in the afternoon, but I'll take a home run. Anyway, we've gone past my 7:15, but I think a lot of people wanted to hear this information. The public, I think, hopefully got some good information. Everybody asked great questions, and I'm sure you get questions out in town, and you want to be able to give them the answer. And hope you don't mind me calling this meeting tonight to try to get you some current information. But I'm convinced with the people we have on board and the attitude of the people that we have on board and the dedication from the medical people to the first responders, we're going to whip this thing. We can't tell you when, but we will whip it. And we're going to come out better for it. And I'd like to ask Mr. Zanoni if you have any closing comments that you'd like to make.
I don't have any closing, but I did have one more question for Annette, and really the judge would probably be best to answer it. But do we have an update on the former Memorial Hospital being converted for?
That's really Hillary.
Hillary?
So,
Okay, maybe
yes.
Hillary can. Yeah, we know that, we've heard Judge Canales, and I've personally worked with her in the community levels on converting the former Memorial Hospital. What is the latest on it?
Yeah, a portion of the hospital was identified as a possible alternate care site. We did some flushing that out here locally, and then we had a team from the Army Corps of Engineers came in and they surveyed it, made some recommendations, and that's as far as it really stands right now, as far as I know. We're waiting to move forward with, I say they're waiting to move forward with that. Where we come into play there is, my agency's the vehicle by which they will get the resources. Just like there's a process for requesting things from the state, it goes through us, and it goes through the Division of Emergency Management. So we can certainly help provide, the staffing if there's staffing available, and any durable medical equipment, hospital beds, so on and so forth. But that's as far as I know. I defer that to the judge.
Mayor, I forgot one question. I apologize. Remdesivir, are we still in shortage of that medication? DSHS, Department of State Health Services, just made a drop to some areas around the state based on the needs. I know that Shoreline has received some last month, I believe, or back in May. Is it enough for everyone?
I'm not sure. It was a case of it, and it's not the treatment, as I'm sure you know, but it is an optional. It's an option, between the patient and the physician if they feel that that's an appropriate course of treatment. It's certainly not the treatment for everybody. If I'm wrong, please correct me, Annette. I too am not a physician, so you're getting into a lane that's not necessarily mine.
What I heard was we just recently received a shipment of the remdesivir, and so enough for 600. So, but that's not enough for everybody, but
Okay.
600.
Thank you.
You're welcome.
Just
Well,
a follow-up to your question, Peter. The other day, the judge, I think, was asked that question in the Q&A period, and there's a lot of unanswered questions, and I guess the biggest question is, and I think you hit on it, in that you say, well, they're converting a cafeteria to be an extra, but the issue I think you're dealing with, if you go and you spend X number of dollars over 90 days or however long it's going to take, is just the manpower to staff it and splitting your employees between existing hospitals to try to man it. That's going to be the key there. I mean, everybody's working 24/7 now, and I'm not sure I think that's what the hospitals are wrestling with, is how would we, if we got more space, what would we do with it and how would we man it?
Exactly.
So I think that's the big question, whether you want to go to the financial expense, because as anything, the brick and mortar is the cheapest part. It's the operating expense. And so when you start dividing and splitting your staff and your equipment and your materials, you're just running up the cost and wearing everybody out. So there's a whole lot of dialogue going on, I understand, from between the hospitals and the staffs and the judge. And that's kind of the hospital district in the county. That's not really the city, but that's kind of what I heard in her explanation the other day. But we want to stay tuned to find out about it. But the other thing is, if it's going to, hopefully, this COVID's going to be over in, 30, 60, or 90 days. And if you're getting a building remodel in 90 days, and then we're on the downhill side, then you got a building and you spent X number of dollars and you don't need it. So that's the other dilemma. But anyway, it's a great question, and I think you need to look at all options and that sort of thing.
I agree.
Anything else, Mr. Zanoni?
I believe that's it, Mayor. Yeah, thank you for the mayor and council for getting this update. I think it was real helpful for you and the watching community.
All right. Well, I appreciate, again, the council taking time out of a week that you weren't scheduled to have a meeting, but I thought it was important that we do get some information in, and I think there was a lot of good information that was presented by Annette and Hillary that probably the public has never heard before. And hopefully that we had a good number of folks watching. But it is about 5 minutes to 8, and if anybody else has no more questions. Anybody from the hinterland out there in the cloud? I think they've all gone to sleep. All right, this meeting is adjourned.
Thank you.